This recorded lecture will be going over Chapter 7, Drugs for Viral and Retroviral Infections. A virus is a small infectious agent that can reproduce only inside other living cells of a host organism, including human cells. Viruses consist of RNA or DNA genetic material that is surrounded by a protein or fatty coating known as a capsid. The virus inserts its own genetic information into the host cell's nucleus and hijacks the cell's operations. This causes the host cell to produce and release more virus particles, and the infection spreads. Damage, breakdown, and eventual death of the infected cells occur with a viral infection. Viruses cannot survive or reproduce without the host. Viral infections are not killed or suppressed by antibiotics. Antiviral drugs must enter the infected cell and act at the site of infection to be effective. Antivirals do not kill the virus, but rather they stop viral reproduction. This action means that all antivirals are virustatic, but not virucidal. Antiviral drugs work in a variety of ways: by blocking the virus from entering the host cell, by targeting the enzymes and proteins inside the host cell that allow the virus to replicate and then leave to infect additional cells, or by helping the host's immune system fight the viral infection. Herpes simplex virus type 1 is responsible for common cold sores of the mouth. Herpes simplex virus type 2 is responsible for genital herpes infections and lesions. As with all other viruses, after a person becomes infected, HSV always remains in some tissues. However, symptoms will come and go in patterns called outbreaks. An infected person is more likely to spread the virus to other people just before symptoms occur and during outbreaks. The goal of HSV antiviral therapy is to prevent outbreaks, which also helps reduce the spread of disease. The common antiviral drugs used to treat HSV infection are acyclovir, famciclovir, and valacyclovir. They are viral DNA polymerase inhibitors that form counterfeit molecules in the infected cell that block the virus and its enzymes from making more genetic material and virions. Without the genetic material, the virus cannot reproduce. Drugs in this class are most often used to prevent and control HSV infections. However, they can also help to control the symptoms of varicella-zoster virus infection, which causes chickenpox and shingles. This is because VZV and HSV have similar enzymes. For influenza viruses to infect cells, they must first open their outer coats to be able to fuse with the host cell membranes. Most viruses that cause common influenza use a special viral enzyme on their surface, known as neuraminidase, to help the process of infection. There are two types of drugs used to treat influenza: the neuraminidase inhibitors, like oseltamivir and zanamivir, and those that prevent the virus from opening the outer coat, including amantadine and rimantadine. All of the antiviral drugs used for influenza work to prevent infection in a patient who has been exposed to the virus or to reduce the symptoms of an existing influenza infection. They work best when given after exposure or before symptoms start or within 48 hours of the onset of symptoms. They are used for short-term therapy, typically 2 to 4 days. Unfortunately, many strains of influenza are becoming resistant to these drugs. Cytomegalovirus is a virus of the herpes family that can infect human cells. In those whose immune systems are not functioning well, like people with AIDS, newborns, and people who are immunosuppressed due to chemotherapy, CMV infection can cause serious problems, including brain infection, which could lead to brain damage and death, as well as serious eye infections, which could lead to blindness. Respiratory syncytial virus, or RSV, is a common respiratory virus that infects the lungs and bronchial tubes. It is a common cause of chest colds, croup, and pneumonia in children. For healthy people who have good immune function, the disease it causes are mild, and most people will recover in 5 to 7 days without treatment. However, in premature infants, newborns, small children with chronic illnesses, and older adults with weakened immune systems, the respiratory infection can be severe and even lead to death. Drugs used to treat CMV infection are members of the viral DNA polymerase inhibitor class. They inhibit the viral enzyme's ability to make more DNA for viral reproduction. The drugs used for this purpose are cidofovir and foscarnet. They are extremely toxic, given IV, and are used on a short-term basis to reduce infection symptoms. The only drug approved for treatment of RSV infection is ribavirin. It is very toxic, even when given in an aerosol form, and it requires careful handling. Hepatitis B virus and HCV are hardy viruses that can live in a variety of environments. In the United States and Canada, these viruses cause infection most commonly by the blood-borne route and by sexual transmission. Both have a long incubation period after infection, followed by an acute illness and then often a chronic illness. The acute phase of HBV disease may produce a noticeable illness in about 30% of infected people. The acute phase in others is so mild that there are no obvious symptoms. For HCV, few infected individuals have any symptoms during the acute phase. In HBV and HCV disease, active virus remains in the blood forever. Some people with hepatitis B have a chronic recurrence of symptoms from time to time. With hepatitis C, the disease remains dormant for years and then causes profound liver damage with cirrhosis. The major drugs used to treat hepatitis B fall into 3 classes: nucleoside reverse transcriptase inhibitors, DNA polymerase inhibitors, and interferon. The DNA polymerase inhibitors are adafovir, entecavir, lamivudine, and telbivudine. This class of drugs is used to treat CMV infection. They are given orally, once daily, and for a long-term course. Interferon, specifically PEG interferon alpha 2b, is a synthetic injected drug similar to the interferon the human body makes to fight viral infections. Life-threatening neuropsychiatric events, including suicide, homicidal ideation, depression, relapse of drug addiction, and aggressive behavior, has occurred in patients with or without previous psychiatric disorders during interferon alpha-2A therapy. Its use is no longer recommended for the treatment of hepatitis C due to poor efficacy and the high rate of adverse effects. The 6 identified HCV strains are genetically different and do not change over time. The drug Harvoni, a combination of ledipasvir and sofosbuvir, is used to treat 4 of the genotypes of chronic hepatitis C infection. However, the extreme cost of this drug for 12 weeks of treatment prohibits many patients from using it, and they instead continue with more standard therapy. The US FDA released Mavuret in 2017. It covers all 6 genotypes and results in a 92 to 100% cure rate for hepatitis C. The cost is approximately $25,000 for an 8-week treatment. Expected side effects of antivirals include vomiting, nausea, diarrhea, and headache. All drugs can cause hypersensitivity and/or anaphylactic shock. Be aware of rashes, hives, difficulty breathing, and facial swelling. If hypersensitivity reactions occur, the drug should be discontinued and prescriber alerted. Many antivirals also have drug interactions. To be prudent, you should always look up current information. Notice that the antivirals have a common suffix of vir or dine. Table 7.2 lists some very toxic IV antivirals used for more serious problems of CMV, retinitis, and RSV infection. All of these drugs carry a serious warning for patients and black box warnings for healthcare providers, and caution must be taken. Teach your patient and family the following. When using topical drugs for the treatment of HSV1 or HSV2, use gloves and wash your hands thoroughly to prevent the spread of infection. There is no cure for herpes. To be effective, oral drugs should be started at the first sign of infection or reinfection. The drugs must be used daily for suppression of the herpes virus. When using antivirals for flu, it is best to begin within 2 days of becoming ill. Antivirals do not cure the flu, and there is still a need to reduce symptoms like fever, cough, and pain. Check yourself daily for any worsening symptoms that could indicate pneumonia or bacterial infection. Antivirals can be used for prevention or prophylaxis of the flu in an unvaccinated person who has been exposed to the disease. Always follow specific storage instructions listed on the package for the drug. COVID-19 is an infectious disease caused by a new coronavirus called the SARS-CoV-2 or novel coronavirus. The majority of people infected with COVID-19 will have mild to moderate respiratory illness and other flu-like symptoms that last for 1 to 2 weeks. Older adults and others with chronic medical problems like cancer, COPD, diabetes, and cardiovascular disease are most likely to develop serious illness. It is estimated that around 1% of persons who have COVID-19 will die. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. COVID-19 is most likely to be spread if people are closer than 6 feet from one another. Because COVID-19 is easily spread and persists in the community, it is highly advisable to wear a mask and stay away from crowded settings to prevent infection and spread. Many ongoing clinical trials for treatments and vaccinations for COVID-19 are currently in progress, but at present there are no specific vaccines, treatments, or cure for COVID-19. Clinical management of the virus incorporates infection prevention and control measures, supplemental oxygen and mechanical ventilation when indicated. In October 2020, the FDA approved the use of the drug remdesivir to treat patients hospitalized with COVID-19. Remdesivir is an antiviral drug administered IV for up to 5 days. Previously, remdesivir was only used in severe COVID-19 patients under emergency authorization. Common adverse reactions in these patients included anemia, elevated liver enzymes, hyperglycemia, AFib, and respiratory arrest. Safety and efficacy of the drug in patients with non-severe COVID-19 is unknown at this time. In July 2020, the US NIH recommended dexamethasone 6 mg daily for up to 10 days for patients with severe COVID-19 who are requiring supplemental oxygen or mechanical ventilation. A retrovirus differs from a virus in that instead of merely hijacking a cell's DNA or RNA to reproduce, it transmits its own information into the cell's DNA. Proteins, which are the building blocks of all tissue, are formed from the DNA information of genes. A retrovirus is a viral organism that carries special enzymes and uses RNA instead of DNA as its genes to reproduce. The retrovirus inserts its genetic material into the host DNA. The retrovirus uses the host cell's metabolic systems to make new virions that leave the cell and infect more cells. The human immunodeficiency virus is the specific retrovirus responsible for the immune system problems associated with the destruction of helper T cells. Infection results in HIV disease, which progresses to acquired immunodeficiency syndrome. After a person becomes infected with HIV, he or she will have the virus for life. HIV attacks the body's CD4 T cells that are responsible for helping the immune system fight infections. If HIV infection is left untreated, the decreased number of CD4 cells in the body makes the person highly susceptible to infections like tuberculosis, viruses such as CMV, and cancers like non-Hodgkin lymphoma. It is characterized by a breakdown in the immune system that leaves the patient unable to fight infections. The patient is diagnosed with AIDS when the CD4 count falls below 200 cells per millimeter. The normal CD4 count is between 500 and 1500 cells per millimeter. In the United States, the groups at the highest risk for development of AIDS include homosexual and bisexual men, although the fastest growing group is minority heterosexual women. HIV most often affects African American and Hispanic individuals. Transgender women who have sex with men are among the groups at highest risk for HIV infection. IV drug users remain at significant risk, and other high-risk groups are children born to HIV-positive women and individuals whose sexual partners have HIV or AIDS. According to the CDC, the rate of HIV-infected persons in 2018 was highest for persons 25 to 34 years of age, followed by persons 35 to 44 years of age. 1.2 million people 1.2 million people aged 13 and older who live in the United States are infected with HIV. The CDC estimates that 14% of people who live in the United States are infected with HIV but don't know it. The HIV life cycle has 7 steps, and HIV drugs are designed to attack the virus at different steps. Antiretrovirals are an important part of a group of drugs that slow the growth or development of the duplication of retroviruses. They are used to limit or slow the advance of HIV disease and its progression to AIDS. Antiretroviral drugs are used in treating patients infected with HIV or adults and children at risk for HIV and AIDS. They do not cure HIV or AIDS, but they do help patients live healthier, longer lives by interfering with the ability of the retrovirus to replicate and slowing the production of new retroviruses. All antiretroviral drugs are virustatic rather than virucidal. None of these drugs will kill the virus. Therapy for HIV infection and AIDS works best when several types of antiretroviral drugs are used together daily. This type of therapy is known as a combination antiretroviral therapy. The 7 categories of antiretroviral therapy drugs are NRTIs, non-nucleoside reverse transcriptase inhibitors, PIs, integrase inhibitors, fusion inhibitors, entry inhibitors, and post-attachment inhibitors. They are all called inhibitors because rather than killing the virus, they suppress retroviral reproduction by preventing HIV from infecting the host cells or by obstructing various steps in the HIV life cycle. None of these drugs is effective against HIV when used alone. Although ART is usually started and managed by healthcare providers in special settings and clinics for immune disorders, this drug therapy must continue for the rest of the patient's life. Therapy is effective only if the patient takes the prescribed drugs correctly and on time, at least 90% of the time. Nucleoside reverse transcriptase inhibitors are antiretroviral drugs that have a structure similar to those of the 4 nucleoside bases of DNA. Without reverse transcriptase, HIV cannot make new copies of itself. These drugs work early in the HIV life cycle. A non-nucleoside reverse transcriptase inhibitor is an antiretroviral drug that binds directly to the HIV-1 enzyme reverse transcriptase, preventing viral cell DNA replication, RNA replication, and protein synthesis. With these actions interrupted, HIV reproduction is slowed or stopped. These drugs work fairly early in the HIV life cycle. A protease inhibitor is an antiretroviral drug that suppresses the formation of infectious virions by inhibiting the retroviral protease enzyme. They act later in the life cycle of the virus. PIs block the HIV enzyme protease and prevent these important proteins from being activated. As a result, infectious HIV virions are not produced and released. An entry inhibitor, also known as a CCR5 antagonist, is an antiretroviral drug that prevents cellular infection with HIV by blocking the CCR5 receptor on CD4 T cells. Entry inhibitors protect uninfected cells from HIV infection. A fusion inhibitor is an antiretroviral drug that prevents cellular infection with HIV by blocking the ability of the HIV surface protein GP41 to bind or fuse with the host cell CD4 receptor. Without fusion, infection of new cells does not occur. Like the entry inhibitors, fusion inhibitors protect uninfected host cells from becoming infected with HIV. An integrase inhibitor is an antiretroviral drug that inhibits the HIV enzyme integrase, which the virus uses to insert the viral DNA into the host cell's DNA. Without this action, viral proteins are not made, and viral replication is inhibited. Integrase inhibitors work early on in the life cycle of the HIV infection. Most antiretroviral drugs are taken in combination, and determining which drug is causing the side effects can be difficult. Some of the side effects caused by HIV disease are also caused by the drugs used to treat it. Common expected side effects of all antiretroviral drugs include mouth ulcers, nausea, and diarrhea. Rashes and headaches are also common. Antiretrovirals often cause severe toxic reactions. Many of these drugs can damage the liver or kidneys. Many will also cause pancreatitis. Pre-exposure prophylaxis, or PrEP, can prevent HIV transmission to the uninfected sex partners of people who are HIV positive and using ART. The drug approved for this purpose is tenofovir disoproxil fumarate, 300 milligrams, and emtricitabine, 200 milligrams, which is an oral tablet taken once daily for as long as the person remains at risk for infection. It is only taken by people who are HIV negative but who are at risk for becoming infected. Descovy, a similar drug to Truvada, contains emtricitabine 200 milligrams and tenofovir alphanamide 25 milligrams. Descovy was released in late 2019 and contains a different form of tenofovir that is thought to be less toxic to the kidneys. The patient taking ART has probably been doing so for some time, and they may know more about these drugs than you do. However, it's always important to remind the patient and their family about the following. Take the drugs exactly as ordered every day to ensure that they work properly. Taking too little of the drugs or skipping a dose will lead to drug resistance and disease progression. Use pill boxes, pill reminders, and/or diaries to maintain strict compliance. Take the drugs at the same time every day and use a cell phone reminder for time alerts. Alert your healthcare provider immediately about specific symptoms that could indicate adverse reactions. Do not cut down or stop the drugs until told to do so by your healthcare provider. Safer sexual practice and standard precautions must be taken to prevent disease transmission. Impaired immunity makes it easier to contract diseases. Avoid fruits or vegetables that cannot be peeled or scrubbed. If you are lactating, stop breastfeeding your baby because there is a high risk of HIV transmission in breast milk. Report any new over-the-counter drugs, herbs, vitamins, illegal drugs, and nutritional supplements to your prescriber because they could cause increased adverse reactions. Do not miss clinic or lab appointments. Avoid alcohol and recreational drugs due to the increased risk of liver damage associated with these drugs. Report signs of neuropathy. If you have symptoms of pancreatitis, notify your healthcare provider immediately so that treatment can begin.